Good morning. I am State Representative Dan Miller from the 42nd District in Allegheny County. Thank you so much for joining us. Glad to see everybody here, and we're glad to have such a great amount of legislators who were able to squeeze it in today, too. We know that there are a bunch of legislators who are caught up in ethics training, but also we're very interested in today's topic. Obviously, what we're going to do is we're going to hear from a bunch of legislators and some providers, some experts in relation to mental health. The key component here is we recognize that school safety is a popular topic that's going on in both the House and the Senate at this time. Understandably, it should be, and some would say it should have been before. But we also want to be sure that in this debate, that issues of mental health are appropriately framed in that discussion. We do believe there are some things on the mental health side that can be done. Some may consider those to be relation to school safety. Others would just say it's relation to being sure that every kid has the services they need to be able to enjoy life and to reach their utmost capacity. So no matter how you look at it, we do have some ideas. The one thing we want to be sure that everybody is clear on is the vast majority of people and kids with mental health issues are of no danger to anyone. And they are more likely to be victims than they are to be perpetrators. So we're going to try and help to frame that issue today. The first person we're going to hear from is Representative Mike Schlossberg, who is one of the co-chairs for the Mental Health Caucus here in the House. Mike?
And thank you, Representative Miller, for putting this together. It's great to see so many people behind us and in front of us. As Dan said, my name is Mike Schlossberg. I'm a state representative for the 132nd Legislative District, City of Allentown and South Whitehall Township in Lehigh County. I'm also one of the co-chairs and co-founders of the House Mental Health Caucus. As you can see behind me, the legislators behind us are about as diverse as you get. It takes a rare issue to pull someone as progressive as me onto stage with a couple of folks as conservative as Representatives Ward and Ortite, but mental health is one of those issues. And it's one of those issues that's so important that all of us feel the need to get together to have a conversation about it. Some things unite us. Mental health is one of those things. 1 in 5 Americans are actively suffering from some sort of mental health crisis, which means that of the 10 of us or so on here, that should be 2 of us. 1 in 2 Americans will suffer from a mental illness at some point in their lives. 1 in 20 Americans will suffer from a mental illness so debilitating that they won't be able to go to work. Now, this is an issue not only important to all of our constituents, to all of the people in Pennsylvania. On a personal level, as many of you may know, this is one that's important to me. For the past few years, I've actively discussed my own struggles with depression and anxiety. I see a therapist on a regular basis. I take medication for my depression. And I always make sure to bring that up because this is an issue that absolutely, positively must be destigmatized. We have to stop seeing the mentally ill as people who are shooters or people who are homeless and in the street doing nothing but begging us for money. We are all the mentally ill. Everyone in society knows somebody who suffers. In my case, that's me personally. Unfortunately, we know that mental illness has many profound and negative impacts on the people that those of us who are up here are privileged enough to represent. And at its core, sometimes mental illness leads to suicide. There's a few things about suicide that we don't know, but there's many that we do. We know that suicide rates have increased more than 20% since dropping to an all-time low in roughly 1999. We know that nearly 2,000 people completed suicide in Pennsylvania. And we know that we have more completed suicides on average in this state than we do in other parts of the nation. Some groups are more likely to attempt suicide and require support. We also know that means reduction, a strategy by which you can eliminate potential risk factors to somebody completing suicide, can make a real difference. So I want to talk about a few pieces of legislation that I've been working on. We have House Bill 1822, which would require that all institutes of higher education develop and communicate a suicide prevention plan, gathering resources and making sure that college students who are more likely than average to complete suicide have the resources available to seek help if they so choose. There's a piece of legislation right now that it will hopefully be in front of the Transportation Committee soon that would require that PennDOT whenever they engage in construction or reconstruction, determine whether or not a certain location is a suicide hotspot, and as such, arrange for protective barriers or fencing. In my district, in Allentown, we had the 8th Street Bridge, which usually a dozen or so people completed suicide from a year. They finally were able, after reconstruction, to add fences to it a couple of years ago. There hasn't been a single completed suicide at that location since. That matters. That's important. We also know that the stresses that our first responders face are greater today than ever. That's why I'm working on legislation which would allow for first responders to have access to certified peer mentors, counseling hotlines, and potentially include PTSD as a illness for which they could be compensated. Mental illness is real. The stigma that surrounds mental illness is real. It affects millions of Pennsylvania residents every day, and almost none of these people will commit an act of violence. All of us on this stage are here today because we believe that government has a shared obligation to take care of each other. The mentally ill are not a population that should be shuffled off to the side, a group that should be ignored except when we need a scapegoat for a national tragedy. They are real people, deserving of our love, our care, and our resources, and these are things which we must provide to these folks if we ever truly want to make our community whole. So thank you very much, and with that, I will turn it back over to Dan.
Thanks, Mike. Thank you. I do want to note, too, that as we discuss, we're all here united on that framing that Mike also just helped us do. What you will hear today, or what you won't hear today, is discussions regarding firearms and discussions regarding changes to school physical structures. Those are debates that will come up, but obviously that's not our focus here today. I do want to reference as well that some of the mental health bills may have some different opinions on from some people on the stage. The overall direction of trying to offer more assistance across the board is definitely something that we all share. And so our next partner coming up here is Trish Carbaugh. Trish is from the American Foundation for Suicide Prevention. Been a great partner on a variety of bills. Thank you, Trish.
Good morning. I'm part of the South Central Pennsylvania Board for the American Foundation for Suicide Prevention. I got involved with the organization in 2014 after the loss of my oldest nephew to suicide. With that, I've now learned that a lot of it is also dealing with mental health. So I have joined the board, and I am joining the fight against mental illness and the stigma that goes with it. I do have some facts that I'd like to share. Approximately 20 to 25% of the people in the United States will experience mental health condition in their lifetime, which doesn't sound very high, but they're saying at some point in your life. So many of you may have already had an issue, many of you may be facing issues, but what we have to agree on is getting the right help. And the bills that they're putting out there are definitely on the right track. Most people with mental health issues do not engage in violence. They don't have self-destructive behaviors. As a matter of fact, people with mental health actually tend to be the victim of violence more so than the aggressor. The folks that are, there is one factor that leads to self-destructive behaviors. And some of those factors can be historical factors, health and life experience, lack of effective coping and problem-solving behaviors in a moment. But this is due to a combination of brain function and environmental exposure and not having the proper access to the means to get better. There are typically risk factors and warning signs that can herald intervention. So that's where the screening that they're proposing could be huge. If we screen younger children or college-age students, we could actually get them on the right track to health, to mental health. Youth suicide there's about 45,000 suicide deaths in the United States each year, 45,000 just for suicide. It's the 11th leading cause of suicide in Pennsylvania. Of cause of death, excuse me. In the 15 to 24-year-old range, 13.15 deaths per 100,000. So that number speaks volumes, and it's been rising slightly in that age range for the past 5 years. Mental health is a condition that's present in about 90% of the population, but some of it will go undiagnosed. The AFSP does support the screening for depression and other mental illnesses. And I'm sorry, I'm just looking here. I'll move along. There was an article written recently by a doctor at the AFSP, and she did say, it was Dr. Christine Mountery, and she said that by working together towards a greater access and quality of mental health care in the United States, it can be pointed out that the linkage between mass violence and mental illness is a red herring, misleading and grossly distorted. It's important that people come to know the facts and end mistaken widespread belief that acts of violence are driven by mental illness. In a vast majority of violent acts, a treatable mental illness is not the cause. And that's where they were talking about impulse control, trauma, things of that nature are what is causing the violence, not mental illness. We as a group are here, and we're very grateful for these. And so, yes, if there's anything else that we can do, please let us know.
Thank you, Trish.
Thank you for having us.
Glad to have you here. Appreciate it. Okay, thank you. Our next speaker is my friend who is also a chair of the Disability Caucus, the Autism and Intellectual Caucus, as well as the Mental Health Caucus, Representative Tom Mert. I also want to note that I thank so much everybody here, including Representative Santora and Representative Davison, for making it. And I apologize for everybody who I'm holding as tight as I can to the time frame. So thank you very much. Tom.
Good morning, everybody. Thank you very much for being here, and thank you for your interest in this issue. I especially want to recognize my friend, my colleague, Mike Schlossberg, for his courage and the strength that he has to step forward and to face down the stigma of mental health, mental illness, and help us with this issue. There's two pieces of legislation that I want to talk about briefly. The first is House Bill 440, which is in the Insurance Committee right now. This bill is very, very important. Mental health parity is the law of the land. President George W. Bush signed that into law a few years back, and the law says, the federal law says that we have to treat depression, bipolar, post-traumatic stress in the same magnitude as we treat a broken arm or diabetes or any other kind of physical ailment. The way that this fleshes out in the real world isn't so equitable. And we proposed House Bill 440 to put forth some provisions to help truly achieve mental health parity. A lack of education about parity creates barriers to the enforcement of the law. And the Insurance Department right now has told us that they're unable to accurately inform the General Assembly as to how many Pennsylvanians are experiencing barriers to care through their insurance company. Less than 5% of Americans are aware that they have rights and are entitled to care under the law, and as a result, many consumers aren't appealing denied complaints or requests for services. And essentially what we're saying here is that if someone has to fill out 10 or 15 extra forms to be seen on an ongoing basis for post-traumatic stress or bipolar or depression, that's not mental health parity. We have not achieved mental health parity, and that's what we're going to be working towards. The other issue that I want to make reference to is House Bill 1233. This is a bill that was passed through the House a few months back unanimously. And this bill has to do with assisted outpatient treatment. In Pennsylvania, the 302 commitment process says that unless you are a clear and present danger to yourself or to others, you cannot be committed, either as an inpatient or on an outpatient basis. This has been problematic because there are many individuals who, instead of being referred for health care, to counseling, to therapy, or to possibly for medication with a doctor, have had brushes with the criminal justice system. And some are incarcerated across Pennsylvania. And you know what? Many are veterans. I served in combat in Iraq, and I know some veterans that are serving in the Graterford prison right now because I go to see them almost monthly. And I want to tell you that this House bill, which is over in the Senate right now, it's in Senator Lisa Baker's committee, and she is looking at this very closely, and we're told that they have every intention of running the bill. and bringing it to the Senate with a few amendments. And we're very, very grateful for that kind of consideration. But essentially what this does is it offers another standard to get our loved ones, people that are struggling with mental illness, that are living in a supportive and a loving family, before they have a brush with the law. We want to get them into a civil outpatient treatment situation. And we're very hopeful for this law. And the last thing I want to say is that had this law been on the books in Florida, and had it been used properly, I really believe in my heart of hearts that there's a very good chance that that young man, Nicholas Cruz, had he been referred for counseling and therapy and maybe some mental health treatment, that maybe he would not have done what he had done. So, Dan, Representative Miller, thank you very much for hosting today's press conference and for enlightening us all on this issue. Thank you.
Thank you, Tom. Thank you, Representative Mert. Obviously, great passion from all of our legislators here today. Our next speaker is Chris Michaels from NAMI, Keystone, Pennsylvania.
Good morning. I am Chris Michaels. I'm the CEO of NAMI, Keystone, Pennsylvania. We are the state organization for the National Alliance on Mental Illness. Okay. Our mission is that we advocate for social justice and we fight the stigma and stereotypes regarding mental illness in the system and in society. The discussion today and any future discussion in the House must be based on factual information. Those of us who are knowledgeable, Those of us who are knowledgeable about mental illness will have a standard response every time there's a violent tragedy, and that is that individuals with mental illness are more likely to be a victim of violence rather than a perpetrator of violence. The statement, while factual, has little to no impact on the people we are speaking to. As a factual, standalone statement, it is not changing public perception. Consider this: 46% of Americans think people with mental illness are violent. 60% believe that a person diagnosed with schizophrenia is violent. In 2015, the American Journal of Public Health reported people diagnosed with schizophrenia have a victimization rate 65% to 130% higher than those of the general population. According to Dr. Ed Mulvey from the University of Pittsburgh School of Medicine, an individual with mental illness is 5 times more likely to be murdered and 25 times more likely to be the victim of a sex crime. Studies indicate that there is a modest relationship between diagnosis and reports of violence. Individuals with mental illness are not violent. They represent a very small part of violence in the United States, 4 to 5%. Mental health, gun violence, and school safety is a very complex issue that requires a multifaceted approach. Overall, a public health approach would consider all the elements of school violence. Leading experts in school violence developed a call to action to prevent gun violence in the United States. There's an interdisciplinary group on preventing school and community violence. It includes 200 universities, national education and mental health groups, school districts, and more than 2,300 individual experts who have signed on to support this document. Some key concepts include a national requirement to assess school climate, an adequate staffing, reforming school discipline to reduce the exclusionary practices, a national program to train and maintain school and community-based threat assessment teams, interventions to resolve conflicts and assist troubled individuals, and remove the legal barriers to share safety-related information. The Association of School Psychologists of Pennsylvania have signed on to this call to action. I want to end with a statement from Dr. Mulvey's recent lecture that I attended. If mental illness was cured tonight, totally wiped out of society, no more mental illness, 96% of the violence in America would continue. Thank you.
Thank you. Okay, thank you very much. Our next speakers, it's a tag team. We're very glad to have Representative Jason Ortitai and Representative Snyder to come speak for us today.
Thank you, Dan. I want to thank Representative Miller, Representative Ward, and Representative Schlossberg for their leadership on this issue. Representative Ortitai and I have partnered on a bill. It's a bill that I started 3 sessions ago. My bill has passed Representative DiGirolamo's committee 3 times. It's passed the House in 2 sessions. It died last session in the Senate, and right now it sits in Senator Baker's committee. Act 147 of 2004 was put into place to lower the age to 14 for mental health issues. It was in case mom and dad had the blinders on, but that child knew they needed help, that they would be able to get it. The problem is I had a constituent come to me, and I know Representative Ortitai had a tragedy with a constituent of his. That law isn't always being interpreted properly by all the providers. If a child says they do not want the mental health treatment, sometimes mom and dad then have no say in that. Providers are not understanding consistently what this law was designed for. My bill is very simple. It would allow the Department of Human Services the authority to issue guidelines and adopt rules and regulations to clarify a minor's right to mental health treatment and to clarify all the roles involved, the provider, the child, and the parents. Representative Ortitai reached out to me in this session and asked to partner. We did. He has now expanded on this bill, and he has a bill that he is going to speak about. This is an important issue. We are working in a bipartisan fashion, and I really hope that our bills can make it to the governor's desk for signature. Thank you.
Thank you, Representative Snyder. She was very gracious to let me join her last session in her bill and in this bill and this session as well. As she alluded to, I had a constituent come into my office my first year, and she told me the story about her daughter and how she committed suicide, and she wondered if this law was actually being interpreted correctly. And me, being new into office, didn't really understand what the law actually was. So I took it upon myself to do some research and found out that Representative Snyder was already working on a bill to clarify this law. And so far, like I said, since I've been here, it's passed twice, and with Pam, it's been through 3 times. And we just need to get the Senate to run this bill. This is a really important piece of legislation that we need to get across the finish line, because I really honestly believe at the end of the day, this is going to save lives. So it's really important that we get this bill moved. And I'd like to thank Representative Miller for inviting me to be a part of this, and again, Representative Snyder for being gracious to allow me on the bill. Thank you.
Thank you both. Thank you both. Very important issue. Very important issue. We also have with us from RCPA, Richard Edley.
Good morning, and thank you, Representative Miller, for organizing this event today. Obviously, an important issue. My name is Richard Edley. I'm President and CEO of RCPA, the Rehabilitation and Community Providers Association, one of the largest and most diverse health and human services associations in the country. We represent over 330 providers and members of organizations of health and human services, including specifically mental health and drug and alcohol services, which will be part of this discussion. And as you've heard a lot of important facts today, of which I want to go back and highlight a couple of them. I think they're that important. But most importantly, I think what you're hearing today is that there are very few times in our lives and careers that there's an issue that hits us so much professionally and personally. And that is with mental illness, violence, mental health, and inevitably the stigma that occurs in our society. And we're here today for one reason. Violence has hit our country in a way that's never been seen in the past, and shootings, and as Representative Myrtle referenced, the school shootings have rightfully overtaken the media in terms of public discourse. But what we also see is that soon after these events occur, we quickly move the discussion to how these unspoken acts are in fact related to mental illness. And as our emotions rise, what is not spoken about are the actual facts, and that's what I think you're hearing about today. The news stories suggest a link between mental illness and violence, and as we've said over and over this morning, it's clear that the majority of people who are violent do not suffer from mental illness. And you've also heard that, in fact, those with mental illness are far more likely to be victims rather than perpetrators, 2.5 times more likely to be the victim of violence than to be a perpetrator. So when violent acts occur, we get scared and we reach into our own truths and our own facts. So the conversation, as Representative Miller mentioned, often gravitates to guns and gun control and who should be armed. All worthy discussions. But what we really need to be talking about if we're bringing up mental illness is how are we going to be talking about not so much a link to violence, but rather re-energize our efforts to focus on prevention, early intervention, treatment, and recovery. So I thank you, and if there's one message I'll leave you with today, it's that we should not be using mental illness as a scapegoat for things like mass shootings and violence, but really focus on the correct issues that you've been hearing about this morning. Thank you.
Thank you very much. I almost feel like the specter of something coming up on everybody. I'm doing the best I can on the time. We are very glad to have Chairman Gene DiGirolamo join us. I know his schedule kind of flipped a little bit here, but we're glad to have him. Gene, come on up.
Good morning, everybody. Good morning, everyone. Certainly, you've heard, and if I'm looking at my colleagues, it's a bipartisan issue. This is certainly not a partisan issue. And mental health disease is something I think that affects almost every family. Everybody's got a loved one or has a friend that has a loved one that has this disease. And it affected my family. And I've been very open about my son, who was a heroin addict, who is now in recovery. But I also have a daughter who struggled with mental health issues for years. And I hope I can say this right, but when I look as a parent going through the drug addiction versus the mental health issue, as bad as the drug addiction was, going through what my daughter's going through with her mental health issue is much, much more difficult for the family. With the drug issue, get into treatment. If you come back out and you relapse, you go back into treatment, and hopefully you recover. With mental health, it's almost a lifelong battle with the illness. And I just want to put in, I mean, we've heard about a lot of good bills up here today from both sides of the aisle, and an important issue, but treatment is so important. Treatment works when you get the right treatment for the right length of time. So Medicaid's important, commercial insurance is important, enforce parity, that's very important. Thank you.
Thank you, Gene. Thank you very much. Our scheduled last speaker is my friend and Representative Judy Ward.
Good morning. I'm Representative Judy Ward. And almost 2 years ago, Representative Dan Miller approached me about working together on a bill that would encourage mental health screenings for our school children. As a nurse and a mother, the idea resonated with me. After all, we have vision screenings, hearing screenings, physicals, dental checkups. Why wouldn't we check on our children's mental health? What parent has not wondered if their child is depressed when they spend lots of time in their room away from parents and family? After working with several groups, including PSCA and PSBA, the School Board Association, we've had a great collaborative effort, and we've worked language out to make the bill even better. House Bill 2095 will incorporate mental health screenings at the same time that we do routine physical exams done in 6th grade and 11th grade. Parents may opt out, and the results of this exam are not shared with the school. It's a tool to be used with parents and their physicians to assist students in screening and treatment. It has been an absolute pleasure to work with Representative Dan Miller, because you see, mental health is not a partisan issue. It's a people issue. Thank you so much.
Thank you very much, Representative Ward. Wow, that is 10:30. Listen, a couple of quick things, and I want to be sure to open up to any questions. There are a variety of bills that are out there now on mental health. Representative Davidson has a package of bills on this, including in relation to community treatment, notifying family, and some others. She's got some great efforts being done. We're lucky in this area to have not only the caucus leadership of Mike and Tom, but to have Jean DiGirolamo as someone who cares so much about this on the Human Services Committee, and of course our providers who are all here as well. Listen, we're short on time with it, but I am very proud of every one of these people's efforts to be here today, and their bills, their legislative efforts, and their advocacy efforts. We want to be sure that if you or your family have a loved one with a mental health issue, that we want you to know that we care, and we are looking to do things that are going to help you reach the highest of your potential. We know what real investment means. We know what it is to not have access to care and treatment that you need as well. You know, we're aware of that, and we're fighting for it every day. And in the discussion that comes up in relation to school safety with it, we do have some ideas that we think can be helpful to the wellness of everyone there. But we are unwilling to take a step back in relation to stigma and negative stereotypes as to the mental health community as a whole. So I think that kind of encapsulates everybody here with it. I apologize for not having as much time as we would love to have, but we would be open to any questions. I asked, in particular, Mike Schlossberg to join me up here with it. Thank you, everyone. But any questions regarding any of the bills or topics today?
Are there any bills that you're planning to push sooner than others or give higher priority than others?
Honestly, it depends. For me personally, no. I think the ones that you heard up here are very, very important. I will say that after Parkland, I think there's been an added emphasis on school safety and on the mental health and mental well-being of children. If Parkland gets used to improve the lives and the mental health of children, something good could have come out of the tragedy.
That's a very good question, and my answer would be House Bill 1233, which has already cleared the House and is in the Senate right now. And as I mentioned, Senator Lisa Baker has very graciously been considering that bill, and her staff is vetting the bill as we speak. And there's a good chance that the bill may even get out of the Senate committee sometime this month. But again, that is assisted outpatient treatment, a revision of an outpatient commitment, what the standard is now. Right now, the standard is clear and present danger to yourself or others for inpatient and outpatient. We really believe that the outpatient commitment process should be a little more flexible. I'm not saying that we're lowering the criteria or anything like that, but the criteria should be a little bit different. Many of these individuals that struggle live in supportive and loving family environments, and they should stay there if possible.
You know, and I do want to mention that Chairman Hickernell has been very kind to share with us a list of bills that the committee, his committee, the Education Committee, is looking to get into on Thursday. There are a couple bills there of note. I would reference, in particular, again, 2095. So 2095, and I know Judy did a great job with it, but keep this in mind. Right now, you bring a child to school. That child is having every physical health check that's going to happen. Dental, the vision, the hearing, the scoliosis, immunizations. That's happened, and that's considered standard. Nobody bats an eye really in relation to those checks. The one thing we don't check isn't anything to do with mental health. Not at all. We just assume that, hey, things are working out, no big deal. We've done a very good job in this country and in the state in moving early intervention for disabilities. The one aspect that we haven't really done is early intervention in relation to mental health. And we know this. If you are a young person at school who goes undiagnosed and untreated and unsupported, the chances of you developing or having more at-risk behavior goes up. The chance of success goes down. So I think 2095 is something I'm really hoping that we can talk again with Chairman Hickernell this week and hopefully get some movement on. Another question.
Kind of struggling a little bit with what seems to be a mixed message. You folks are talking about mental health, school safety. The advocates were all saying that's a false swing. Mm-hmm. Can you reconcile that?
You know, that's exactly what we're talking about. So clearly, I don't think anybody can say that there's not a percentage of anything. So when you're looking at the entirety of it, can you say one incident didn't have some component of a mental health reaction incident of some type? The reality of it is, though, is we're concerned that 1% or one incident that somebody finds is the dumping ground for everyone's discussion into school safety. So we do think that you can look at mental health. You should look at mental health in helping our children and young adults and everyone reach their full potential in life. And it's okay to talk about it. It's not okay to turn around and say, well, listen, we're going to address our school safety matters by dumping everything onto the mental health community and onto their shoulders. So that's exactly, we recognize people are talking about it. That's exactly why we're here, and we're trying to frame it in that light.
Yeah.
You talked about quite a few number of bills. Do you have any idea of estimated cost for any of them as of right now?
Honestly, it depends. Yeah, I would say it depends on the particular bill. I'll use one of the ones that I mentioned, the idea of requiring PennDOT to consider erecting fences if there's a suicide hotspot. Certainly there'd be a cost associated with that. It would depend on the particular bridge in question. Other legislations like screenings that could have some administrative costs on schools and certainly some potentially on parents or on Medicare. But it depends on the bill. It's a little tough to say. I will say that as we have had such a conversation about mental health lately, which is, as Dan just said, you know, to some extent, there's always going to be a safety component. By and large, it's not. At some point, we have to decide as a society to put our money where our mouth is. If mental health is truly important, we actually have to fund treatment options. Simple as that.
The fiscal note on House Bill 1233 is zero. It will have no cost to the Commonwealth.
There are a couple other bills as well. We have a bill, Representative Ortita and I have a bill regarding reporting of attempted suicides or suicides on school property. You know, we require schools to report whether or not a child brought in a bag of weed. Okay. But it's up to the school district, if they wish to report at all whether or not an attempted suicide or suicide happened on their school grounds. So I haven't seen the fiscal note on that. I'd be shocked as to what it would be given what else we have them report. Additional questions? Hey, listen, thank you so much, everybody, for the time. Appreciate it.